In this video, I'm covering one of the commonly used methods for calculating medication dosages, the ratio and proportion method. I'll walk you through definitions, step-by-step examples, and tips to avoid common calculation errors. Stick around to build your confidence with dosage calculations. Before we dive into the calculations, it is important to understand the basic concepts of ratios and proportions. A ratio shows a relationship between two numbers. For example, if one slice of pizza costs $1.50, the ratio of slices to cost is 1 to 150 or 1 over 150. It illustrates the relationship between the number of pizza slices and the costs. A proportion is an equation stating that the two ratios are equal. One piece of pizza for $1.50 equals 2 pieces of pizza for $3, which equals 3 pieces of pizza for $4.50. The three ratios are equal in value, so they're said to be in proportion. By cross-multiplying and solving for the unknown, you can determine the correct amount of medication to administer. The ratio and proportion method works by comparing first the available medication, what you have, to the desired dose, what is ordered. We set it up like this. A over B equals C over D. A is your dose on hand. B is the quantity that contains the dose on hand. C is your prescribed dose. And D is the unknown quantity, what you're solving for. So let's look at some examples. First, a tablet calculation. The medication order is 1,000 milligrams. The medication is supplied as 250 milligrams per tablet. Set up your proportion. The first ratio is the medication supplied, 250 milligrams per one tablet. The second ratio is the desired dose, 1,000 milligrams per X tablet. When setting up the ratios, they must be arranged in the same order. Put the medication dosages on the top, numerator, and the number of tablets on the bottom, denominator. You can reverse the order, and it won't change the answer. But you need to have the ratios set up with the same item on top and the same item on bottom of both ratios. Now you will cross-multiply. 250x equals 1,000. Then divide both sides by 250 to solve for x. X equals 4 tablets. You would administer 4 tablets. Always review your answer to ensure it makes sense. The reverse method is to multiply the amount to be administered, 4 tablets, by the concentration available, 250 milligrams, which equals the prescribed dosage, 1,000 milligrams. Here is another example. The order is Lasix 10 milligrams PO daily. The medication supplied is Lasix 20 milligram tablet. How many tablets should you administer? Set up your proportion. The first ratio is the medication supplied, 20 milligrams per one tablet. The second ratio is the desired dose, 10 milligrams per X tablets. Solve for the number of tablets by cross-multiplying. 20x equals 10. Divide both sides by 20 to solve for x. X equals 0.5. You would administer half of a tablet. Always review your answer to ensure it makes sense. The reverse method is to multiply the amount to be administered by the concentration available. 0.5 times 20 milligrams, which equals the prescribed dosage of 10 milligrams. Let's complete another example, a liquid suspension. The medication order is amoxicillin, 500 milligrams PO every 6 hours. The medication supplied is amoxicillin oral suspension, 250 milligrams for every 5 milliliters. How much should you administer? Set up the proportion. The first ratio is the medication supplied, 250 milligrams for every 5 mLs. The second ratio is the desired dose, 500 milligrams over X milliliters. Solve for the number of milliliters by cross-multiplying. 250x equals 2,500. Divide both sides by 250 to solve for x. And x equals 10. You would administer 10 milliliters of the solution. Always review your answer to ensure it makes sense. The reverse method is to multiply the amount to be administered, 10 milliliters, by the concentration available, 50 milligrams, which is calculated by 250 divided by 5. And that equals the prescribed dosage, 500 milligrams. Now, let's calculate a weight-based order. The medication ordered is enoxaparin, 1 milligram per kilogram subcutaneous. The medication available is enoxaparin, 100 milligrams in a pre-filled 1 milliliter syringe. How much of the syringe will you inject? The order reads for 1 milligram per kilogram. This is a weight-based order, so you need to calculate the amount of medication to administer based on the patient's weight. The order reads for 1 milligram per kilogram. The patient's weight is 92 kilograms. For every kilogram of body weight, the patient should receive 1 milligram of the medication. 92 times 1 milligram equals 92 milligrams. The amount of medication ordered based on the weight is 92 milligrams. So now set up the proportion. The first ratio is the medication supplied, 100 milligrams over 1 milliliter. The second ratio is the desired dose, 92 milligrams over X milliliters. Solve for the number of milliliters by cross-multiplying. 100x equals 92. Divide both sides by 100 to solve for x. X equals 0.92. Administer 0.92 milliliters. Always review your answer to ensure it makes sense. The reverse method is to multiply the amount to be administered, 0.92 milliliters, by the concentration available, 100 milligrams, which equals the prescribed dosage, 92 milligrams. Now let's calculate a more complicated weight-based order with a conversion. The medication ordered is acetaminophen, 15 milligrams per kilogram oral dose. The medication available is acetaminophen 160 milligrams in a 5 milliliter liquid solution. The patient weighs 154 pounds. How much liquid will you administer? When calculating medication dosages, the units of measure must always be the same. The order is based on the patient's weight in kilograms, but the patient's weight is recorded in pounds. The weight must be converted from pounds to kilograms. You can watch the video, Measurement Conversion for Medication Dosage Calculations, if you need to review the method for measurement conversions. To complete the weight conversion, place the patient's weight in pounds as a fraction over 1. Then multiply by the conversion factor of 1 kilogram equals 2.2 pounds. The pounds cancel out. 154 divided by 2.2 equals 70 kilograms. Here you multiply straight across, not diagonally, as in cross multiplication. Next, calculate the dose. The order reads 15 milligrams per kilogram. The patient weighs 70 kilograms. For every kilogram of body weight, the patient should receive 15 milligrams of the medication. 70 times 15 equals 1,050. The amount of medication ordered based on the weight is 1,050. Now set up the proportion. The first ratio is the medication supplied, 160 milligrams over 5 milliliters. The second ratio is the desired dose, 1,050 milligrams over X mLs. Cross multiply. 160x equals 5250. Divide both sides by 160 to solve for x. X equals 32.8125. You would administer 32.8 milliliters. Always review your answer to ensure it makes sense. The reverse method is to multiply the amount to be administered, 32.8 milliliters, by the concentration available, 32 milligrams, based on 160 milligrams divided by 5 milliliters, which equals the prescribed dose. There are key takeaways for using the ratio and proportion method. First, understand the medication order. Is it weight-based? Does it require a conversion? Second, check your units. Make sure they match before solving. Third, set up ratios carefully. Keep the same items in the numerator and denominator across both ratios. Fourth, use cross multiplication. Then divide to solve for the unknown. And last but not least, double check your answer. Ask a colleague or pharmacist if unsure. In the next video, you will find practice problems for oral medications that utilize the ratio proportion method for dosage calculations. Thanks for watching. If this video was helpful, give it a like. Share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.